Experiencing a miscarriage can be one of the most heartbreaking and confusing times in a person's life. If you or someone you love is going through this, first, I just want to say, you are not alone. I know this is difficult, and I'm truly sorry for your loss. Hi, welcome to the Healthy Life Blueprint channel, and in this video, we're going to talk about what happens next, specifically, the medical procedures that may be needed after a miscarriage. I know this can feel overwhelming, but understanding your options can help you make the best decision for your health and recovery. This video is meant to provide clear, compassionate information. But please remember, I'm not a doctor, and this is not medical advice. Always speak with a healthcare professional about your specific situation. Now, let's walk through the different medical procedures that may be needed after a miscarriage, so you can feel more informed and supported during this time. Understanding miscarriage. A miscarriage, also known as pregnancy loss, occurs when a pregnancy ends before the 20th week. It's more common than many people realize, affecting about 10 to 20% of known pregnancies. While the exact cause isn't always clear, some common reasons include genetic abnormalities, hormonal imbalances, infections, or underlying health conditions. It's important to remember that in most cases, a miscarriage is not caused by anything the person did or didn't do. After a miscarriage, the body may expel pregnancy tissue on its own, or medical intervention may be necessary. The right approach depends on factors like how far along the pregnancy was and whether the miscarriage is complete or incomplete. If tissue remains in the uterus, it can lead to complications, such as infection or heavy bleeding, which is why medical evaluation is essential. If you've experienced a miscarriage, it's important to consult with a healthcare provider to determine the best course of action for your health and recovery. Medical procedures after a miscarriage. Oh, and by the way, before we move to the next important point, if you're liking what you're hearing, hit that like button. Let's give it some love. And if you don't want to miss out on our next cool video, smash subscribe and ring the bell, so you're the first in the know. Now, drop a quick I subscribe in the comments, and I'll personally welcome you to the family. With that said, let's continue. A. Expectant management, natural passing. In some cases, the body may naturally complete the miscarriage without medical intervention. This process, known as expectant management, allows the uterus to expel the pregnancy tissue over time. It can take days or even a few weeks depending on the individual. During this time, it's common to experience cramping, bleeding similar to a heavy period, and the passing of blood clots or pregnancy tissue. While this approach can be effective, it's important to monitor symptoms closely. If the bleeding becomes excessively heavy, if you develop a fever, or if the miscarriage doesn't seem to be progressing, you should contact your doctor. A follow-up appointment is usually necessary to confirm that the miscarriage is complete and that no tissue remains in the uterus. B. Medication management. If waiting for the body to expel the pregnancy naturally isn't an option, or if the process is taking too long, medication can help. Doctors often prescribe Misoprostol, sometimes combined with Misoprostol, to induce the passing of pregnancy tissue. These medications work by causing the uterus to contract, helping to expel the remaining tissue more quickly. Most people experience cramping and heavy bleeding within a few hours of taking the medication. Some may also have nausea, diarrhea, or chills. While this method is generally effective, it's crucial to have medical supervision. A doctor may recommend a follow-up ultrasound to ensure that the uterus is empty and that no further treatment is needed. If the medication does not fully clear the tissue, a surgical procedure may still be necessary. C. Surgical management. If the miscarriage is incomplete, or if there is excessive bleeding or a risk of infection, surgical intervention may be required. Dilation Curettage, DNC. A DNC is a common procedure in which the doctor dilates the cervix and removes any remaining pregnancy tissue using gentle suction or a surgical instrument. This procedure is typically done under local or general anesthesia and is quick, usually lasting about 10 to 15 minutes. Recovery is relatively fast, with mild cramping and light bleeding for a few days. Dilation and evacuation, DNE. A D&E is a similar but slightly more complex procedure, usually performed for second trimester miscarriages. It involves dilating the cervix and removing the pregnancy tissue using suction and specialized instruments. Like a D&C, it is a safe and effective method to ensure the uterus is completely cleared, reducing the risk of complications. Both procedures are generally low risk, but as with any surgery, there is a small chance of infection, scarring, or complications. Your doctor will provide post-procedure care instructions and let you know what symptoms to watch for. Recovery and emotional support. After a miscarriage, physical recovery varies from person to person. Mild cramping and light bleeding can last for a few days to a couple of weeks, and your doctor will advise when it's safe to resume normal activities. Emotionally, healing can take time. Grief, sadness, and even guilt are normal reactions, but it's important to remember that you are not alone. Seeking support from a therapist, support group, or loved ones can make a big difference. Be kind to yourself, allow time to heal, and don't hesitate to reach out for help if needed. When to seek medical help. While some discomfort is expected, certain symptoms require immediate medical attention. If you experience excessive bleeding, soaking through more than one pad per hour, severe abdominal pain, a fever, or a foul-smelling discharge, these could be signs of infection or other complications. Always follow up with your doctor to ensure your health and well-being. Miscarriage is a deeply personal and often painful experience, but you don't have to go through it alone. Whether you choose natural management, medication, or a surgical procedure, the most important thing is prioritizing your health, both physically and emotionally. If you have any questions or need support, please reach out to a healthcare professional or a trusted support system. With that said, thanks for watching. Hit that like button, subscribe, and share your thoughts in the comments. And until next time,